Hi, this is Walt Medlin from the Bariatric Medicine Institute, and I just want to take a few minutes to talk to you about drains. If you're watching this video, probably either you have a drain right now or someone you're taking care of does. So the drain that we usually use after metabolic and bariatric surgery is a bulb type drain, and has a little bulb that collapses and has a little spout that when you have it collapsed and on suction, if you close that down, it'll hold suction that way. And I'm going to let go of the pinch here, and you'll see it'll pull air in. And that's usually filled with fluid, and this is also how you empty the drain. You've been taught that probably by the nurse before you go home, to tip it, and you can measure on the sides here 25, 50, 75, 100 cc's. Let's see if I can hold that right in front. There we go. Read those numbers a little better. So when it's time for you to take the drain out, usually 1 or 2 days post-op for sleeve gastrectomy, up to 7 or 10 days after surgery for other operations like duodenal switch and for hernia operations. Usually I cut the tubing a lot shorter than this, but I've left this long for the demonstration. This is the tubing or the drain that's inside. And you can see it's got little channels in it so it doesn't get clogged up. It doesn't actually have holes. Some of the older ones do have holes, and some of the older ones are flat as well, which are a little harder to take out than these round ones. You can see that they come out pretty smoothly. This dot here is where we stitch it at the skin. We surround it with a stitch either there or somewhere further out. We don't want to stitch it out here. If you have the white part showing a lot, then the drain is not really doing anything directly. It's not pulling into the bulb. So we're just going to go to the part that you can see. Say you can see this little dot, or it's sutured a little above, and so the rest of this is going to be inside you. A lot of times we cut this off as well. Sometimes it's very short on the inside, but be aware you may have to pull a fairly long way, even up to a foot, to get it out. You don't have to pull all at once, but you will need to pull steady, or eventually you're going to have to pull that much out if there's that much in you. So there's going to be a stitch around this here, and it's going to be stitched into your skin, and I will come up with a better clip to insert here later, but all you need to do is cut the stitch at the skin. You don't have to cut the stitch on the drain. So just cut it where it goes through your skin, and usually only in one place, and then you can pull, and that drain is going to come out of the hole in your skin. And you can keep pulling. You don't have to pull all at once. You don't want to jerk it or anything like that. And you just keep pulling steady until the whole drain comes out. It sometimes pulls some blood or clot or a little tissue with it. But you take that and just throw it directly into the garbage. In fact, I'd have the garbage can ready right beside you, and some paper towels, because this hole where the drain was is going to leak. Okay, you're going to want to cover that up with gauze or something. You're probably going to have to change it somewhere between 2 and 20 times the first day. It's usually blister kind of fluid or cherry Kool-Aid kind of fluid, kind of yellowish clear or thin red looking. If there's lots of green with it, or bile, and it's bright green, then that is something that's worth a phone call, but you don't want to pull it out, don't want to pull it out if it has a lot of green in the bulb. Now, the other thing I didn't mention, before you pull this out, you don't want to have it necessarily on suction like this, because then it's more likely to be pulling some tissue or something with it. So I'd go ahead and open the top and just take it off suction. You can close it in so you don't make a mess, but make sure it's not actually pulling as you pull it out. It's not pulling suction in the tubing. Okay, and that'll make things feel a little more comfortable as well. Sometimes tissue is caught on this a little bit, very lightly. Think of things crusty and stuck in your nose. It may be a little stuck, but for the most part things are moist in there, and so it'll let go pretty well. And this is designed to be very non-adherent. So if you absolutely can't get a drain out for whatever reason, usually it's this little part of the skin where it is a little more firm, attaching the white part to the clear part, and that really can stretch the skin, and it will be tender at your skin. Think about when you were a little kid pulling out a baby tooth, or pulling off an old scab. It's not usually that tender, but it certainly is not completely pain-free. And the main thing is it's a little scary. So good luck with that. I hope this helps clarify. And Don't worry about calling if you have an emergency, but usually a drain that you're afraid to remove or you just can't remove on time, it can usually wait until the morning. You don't have to do anything in the middle of the night or go to an ER for routine drain problems.